When most people think about going to the dentist, they picture creepy waiting rooms, loud drilling noises, lots of screaming, and pain. With local anesthetics and other materials, dentistry has come a long way, and in many ways it makes the experience more comfortable for the patient as a whole. Although it may seem barbaric and sometimes evil, getting a shot at the dentist is way better than the alternative. Techniques nowadays make getting a shot as painless as possible, and most of the time the pain you feel is from the pressure of the anesthetic entering your tissue, not the actual needle poke itself. Now compare that to having no numbing at all. Getting a tooth pulled out or even getting a filling without any numbing would be pretty brutal, but that's exactly how it was before modern dentistry. You might be wondering how our earliest ancestors possibly fared with no toothbrush and no dentist to go to, but most of the early human fossils don't have any evidence of cavities, and this went on for millions of years. Somehow our ancestors had generally good teeth. If you want to learn more about our ancestors and how they handled their teeth, there's a link in the description below. Although dental problems for our early ancestors were rare, they were still there, and researchers found evidence that our ancestors practiced some concepts used in dentistry today. Our ancestors weren't so dumb after all. Cavities and other dental problems didn't really become an issue until about 10,000 years ago, when our ancestors began farming. This change in diet sparked dentistry to advance. Researchers believe that the first dental drill was invented between 9,000 and 7,500 years ago. They found this out when they discovered fossils that had unique holes in their teeth, something only a drill would cause. Not only were our ancestors able to make these holes, they managed to fill them too. Researchers in Italy discovered the first dental filling material ever used was beeswax, which surprisingly made a pretty good filling material, having both anti-inflammatory and antibacterial properties. But even with these advances, dental care in the Middle Ages was risky and a lot more simplified compared to today. If you had a toothache, your only option was to get your tooth pulled out by the local barber. Now, some of these people were pretty experienced and good at what they did, but sometimes people didn't even have that option, and the nearest guy with a set of pliers was the best thing that they had. Not to mention, anesthesia during this time wasn't really a thing. You can imagine how much it would hurt to get your tooth pulled this way. And your local barber wasn't exactly the cleanest place to be either, meaning people were much more likely to get an infection or another complication afterwards. Other patients didn't even make it that far, and they simply bled to death. One report estimated that over 10% of deaths in London in the 1660s was linked to a toothache. Don't you wish you lived back then? During this time, refined sugar was very popular in London, and Queen Elizabeth didn't hold back. It's said that later in her life, her teeth had turned black, and people had trouble understanding her because her teeth were so rotten. It wasn't until the 1700s when dentistry became a profession. The French surgeon Pierre Fauchard is considered the father of modern dentistry, and he made lots of advances in the field that shaped the way we do dentistry today. He also pioneered many methods to replace missing teeth and invented modern dental braces. It's safe to say Pierre Fauchard was pretty smart and sparked major advances in the field. Although the field was advancing, it wasn't until 1884 when local anesthetics became a thing. Believe it or not, cocaine was the first introduced local anesthetic in the market, first used by an ophthalmologist during eye surgery. But after realizing that cocaine was addictive and may even cause heart or breathing failure, people moved on to other forms of local anesthetic, eventually making their way to lidocaine used in dentistry today. What do you think about dental history? Let us know in the comments section below. As always, thank you for watching, and make sure you hit that like button and subscribe to this channel if you haven't already. See you in the next video.